Hi, this is Dr. Tim Syed, MD, double board certified plastic surgeon. Today we're going to talk about rhinoplasty and sort of a very quick overview of some of the considerations in rhinoplasty surgery. So rhinoplasty is the medical term for what's popularly called a nose job. And I don't really like the term nose job because it sort of makes it sound like this is a very simple and uncomplicated procedure, going in and out, sort of lunchtime operation. And this is really a very sophisticated procedure that takes a lot of planning and good, clear communication between doctor and patient. So when we do a rhinoplasty consultation, the first thing that will be part of that is a full assessment of the patient's medical history, and then we'll take a focused examination looking at the nose from both an aesthetic and a functional standpoint. What do I mean by function? That means how well does the patient breathe on each side? Is there a difference in the airflow between the two sides? Is there something suggesting a septal deviation or any other distortion of the structures of the nose that might need to be corrected? Sometimes some of those components will be covered under insurance, but of course the cosmetic changes that we do that are elective in nature and selected by the patient are not covered by insurance and are considered cosmetic surgery. When we evaluate the aesthetics of the nose, we start from the top and we work our way down. So we look at the slope of the top of the nose, which is called the dorsum, the takeoff point of the nose. We look in profile on both sides and see, is there a bump? Is the nose long? Is it short? Is it prominent? Is it recessed? We look at the nostrils. We look for symmetry. We look at the nostrils in different angles, from below, from each side. We look at the tip of the nose. Is it fairly well defined and narrow? Is it wide? Is it bulbous and round? Is it almost boxy and square? What does the patient think of all of these things, and what are they looking to change? And then we input a lot of that information into our surgical plan, and that's supplemented by some of the digital consultation tools that we've talked about in other videos, including Chrysalix, which allows us to simulate changes on the nose with a 3D model, and Emma Plastic Surgery, a medical record tool that allows us to do illustrations on anatomic pictures of the cartilage and the skin of the body. All of that helps us to really narrow down the choices for the patient and try to set reasonable expectations. Now, of course, these digital tools are not an exact promise of a result, but they really help guide the conversation. The rhinoplasty operation is generally done under general anesthesia in an accredited outpatient surgery facility. It can take anywhere between an hour and 3 hours or so, depending on which maneuvers we're doing. The patient will wake up from the operation with an external splint, a protective device that's put on top of the nose to help with shaping and to protect the nose while it's healing. We also will put splints on the inside of the nose that allow the patient to breathe more comfortably while the inside of the nose is healing. Rhinoplasty can be performed with either the closed tip or open tip approach. The closed tip involves incisions on the inside of the nose. The open tip involves the same incisions plus one that goes across this structure at the bottom of the nose that allows us to really look at all of the anatomy very clearly from different angles. And that's more appropriate for procedures where we're doing more extensive work on the tip or we need to add cartilage grafts, remove tissues, and do more extensive reshaping. Another important consideration in rhinoplasty is ethnicity. So different ethnic groups have specific commonplace features. These can include a very prominent bump on the nose, a wider and flatter nose, prominent nostrils, lack of cartilage support, etc. So taking that into account and then evaluating the specific aesthetic goals of the patient is very important so that we can hopefully match the techniques to what the patient is seeking to achieve. For most patients, it's important that they retain features of their ethnicity that represent part of who they are, and so the goal is not to make the person look like a totally different person, but just a more aesthetic version of themselves. Following the rhinoplasty procedure, we do very close follow-up with the patient, seeing the patient every week or so for the first few weeks. Out-of-town patients can take advantage of video conference tools that we can use to monitor their progress after they go home. And it's important for patients to understand that there is always some swelling with this procedure, and the final results of rhinoplasty may not be fully apparent for up to a year after the procedure, although most of the changes begin to really take shape after the first month or so. To learn more about rhinoplasty, visit our website at timsyedmd.com, or feel free to reach out to us for a complimentary consultation in one of our offices. Thanks.